What is up, guys? Finished my general surgery rotation. It was awesome. I saw way too many cool things to fit in one video. I just picked out some of the good things. I'm not making two videos. First off, as a student, general surgery. Obviously, I'm not cutting anybody open because if I did, they would be dead. In the clinic, I saw patients, physical exams. A lot of times, the patient was there as a referral, so we kind of already knew what was going on in the first place. Oh, you have a hernia. Yep, you definitely have a hernia. Pre-diagnosed patients. In the OR, I was scrubbed in at the table, helping the surgeon. And by helping, I mean like holding retractors, directing the camera. At first, it was pretty difficult, but you get a hang of it. It's pretty fun. I also had the opportunity to sew up portholes where laparoscopic instruments entered the abdomen. I was terrible at it. God bless. So that's what I did. But what did I see? What's some interesting things that I saw? Let's talk about the incident. A unicorn popping out of my belly. Multiple patients would come into the clinic and they'd say, "Hey doc, I've got like this alien bursting out of my belly right here." We would lay them on the table, have them sit up, and sure enough, this little bulge would pop up right in the middle of their belly. Diastasis recti. Pregnant mommies might have heard of this. It's when your abdominal wall muscles separate, leaving a little weak spot right in the middle. Usually asymptomatic, just a cool party trick, I guess. Everybody, look at my alien. Oh yeah. That'd be a weird party. It's not the same thing as a hernia. Hernia essentially means something popping through where it's not supposed to. If you're a dude, the good old, turn your head and cough thing. That's to check for hernias. Inguinal hernias, direct, indirect. I've done this myself. The doctor pokes their finger up your inguinal canal, and if your guts start poking back when you cough, you have a hernia. They'll go in there, put some mesh in, seal it right up. Hopefully it lasts forever. Modern medicine. Moving on. Let's say you're going to the local Chinese restaurant. You love this Chinese restaurant, and you're just going ham at that chop suey. In your exuberance, you bite off half of your chopstick and you swallow it. First word of advice is I would recommend using metal chopsticks in the future. Second word of advice, you'd probably want to go see a doctor about that. Vaguely similar to this, patient came in, stomach pains, abdominal pains. They had a hole in their large intestine. All sorts of things break loose. No bueno. Way to fix it? Snip out the problem. And then you have to rejoin it through an anastomosis. Really interesting how they do it. They take each end, sew each end closed, sew it to the other intestine, poke a couple holes in the side of it, put in a stapler gun, it cuts it, but also staples each side, so when it separates, it joins the two pieces of the colon, creating a patent tube. Pull that out, all you have left is the big hole where the stapler was, sew that up, and anastomosis complete. And in the resected colon, they find a piece of wood. That's what caused the perforation. Wood doesn't show up on an x-ray, so no one knew. Now let's finish up with something at the end of the colon. Bad joke. Hemorrhoids, the bane of Michael Scott's existence. In your rectum, if you have too much pressure down there, there's venous beds there that can expand and bulge out. Very similar to a varicose, an esophageal varicose, which I talked about in a previous video. The thing about hemorrhoids is that they can be painful or they can be not painful. Obviously, if you have a choice, not painful is the way to go. But what separates painful from not painful? Good question. It's called the pectinate line or the dentate line. They're the same thing. Internal hemorrhoids are found above the pectinate line. External hemorrhoids are found below the pectinate line. If it's not painful, easy peasy. Put a rubber band around it, dries up, falls off. Painful, however, if you put a rubber band on that thing, oh boy. They have to put you under. So you're totally asleep, anesthesia, so you can't feel a thing. They take like these fiery electric scissors and they burn and cut them off. And once they burn/cut off the hemorrhoids, external hemorrhoids, they suture the wounds closed to make sure they don't bleed. And obviously this is in a pretty sensitive area. After your surgery, they give you a whole ton of pain pills and a whole lot of stool softener. Just some of the highlights in my general surgery rotation. Subscribe if you want to. I'm halfway to 1,000, so what? Small victories, just teeny ones. I gotta take what I can. More videos coming out about my rotations, so yeah, subscribe. We'll see you in the next video.